can call the Cumberland County Finance meeting to order. We're going to begin with the public hearing of the Human Service Block Grant. So, and it looks like that supersedes the finance meeting agenda. So I will turn it over to you.
And actually, I'm going to turn it over to Brian. Brian has provided leadership into the development of the Human Services Block Grant Plan with the support of our other departments. So go ahead, Brian.
Do I sit there?
Sure, wherever you want to be. Yeah.
I don't, it's okay if I don't. I brought a cheat sheet
That's all right.
because it's my first time.
Well, welcome.
Thank you. So, yes, the Human Services Block Grant. Act 80 established the Human Services Block Grant. Act 55 of 2013 expanded it by 10, so it went from 20 to 30. And then Act 153 of 2016 allowed any county that wanted to participate effective 2017, 2018, and that is when Cumberland County jumped on board with the Human Services Block Grant. It provides greater flexibility in the use of state funding and services described in the plan. And then we are a joiner with Perry County. So there are two plans. Perry County's plan is much shorter because it references Cumberland County's plan because we have three joiners. So substance use, mental health, and IDD are described in the Cumberland County plan and then just referenced from the Perry County plan. It is a comprehensive plan. It goes over, it has in there about the cuts that we have made. It goes over the services that we provide. It is all services, not just services that the county funds for. It is services that like Medicaid or other funding sources pay for as well. It looks at our strengths and needs by population. So that is, like adolescents or children, transition age youth, then adults, then older adults, LGBTQ communities, racial, ethnic, and linguistic barriers, substance use, and then criminal justice involved. So it is a big plan. Right now, it's like 125 pages. I think is where it's at. It could go beyond that depending on if there's any additional testimonies provided or anything like that. As far as the mental health portion, it does ask us, so what are our priorities for this coming year? And our number one priority is to maintain and monitor our current services, attempt to keep them in place and as is. And that's just based on, our allocation. We have progression toward alignment with SAMHSA's best practice guidelines for crisis and mobile crisis. And then, that would be the walk-in center. And then expansion of services to support forensic population with serious mental illness. Because, our prison folks, there's a lot of individuals incarcerated with mental illness that honestly, that's not the place for them to be. They need to be in treatment and services. So we do need to conduct two public hearings. This is one of them. The other public hearing will be in Perry County with their commissioners. And that is August 4th at 10 a.m. And both locations, I plan on providing testimony at both locations for those who cannot be there in person because Perry County does not have a virtual option. So it will be an in-person only meeting. So I would be reading the testimony, or if folks are there to do that, obviously they would do that on their own. But then, if testimony is provided, so if there's anyone providing testimony today that has not already given me it in writing, I will need it in writing. That is one of the things that the plan requires, so it can be submitted along with it to the state. So I don't know if there's anything.
Well, typically what we do is the mental health portion, we talk about that aspect, and then we go through the other parts of the plan. So Mark Evans wasn't able to be with us today, so I'm going to be pinch hitting for him.
Could you please remind us?
Sure.
The time frame on this particular plan? I know that it says 2025 to 2026. When is the start date?
It was technically effective
July.
July 1.
Yeah,
Yeah.
Yeah.
And if you look at the act, it actually says, I believe the date is May 1, that we should be receiving this information, and we have had it, I believe, June 11th.
June the 11th, we got
is
it.
when we
It's,
received
it's
it.
due August
It's
11th.
due August the 11th, so the turnaround is actually quite tight. Hopefully that's helpful.
yeah, thank you.
It
Sure.
is, and I'm gonna have some questions. I know that I'm gonna have some follow-up questions based upon some information that we received from the office of the governor.
Okay,
So,
Great.
thank you.
okay, so I'm gonna pinch hit for Mark Evans and go through the IDD aspects, and then we'll turn it over to Brenda. And I think Kim Winton may be on the call. Okay, all right. So specifically around our ID and autism services, intellectual developmental programs and the autism services, the focus has been on in-depth areas of service that will help individuals with intellectual disabilities and autism to achieve the goal of everyday life. Because we operate from the belief that individuals with disabilities should be able to receive the services and supports they need in their home communities. Individuals have choice and control over their services, and the services offer choice, growth, development, and they provide as much independence as possible. Cumberland Perry, like mental health, operates serving both programs, both counties, Cumberland and Perry County. The ID program has the administrative entity, the intake office, and the supports coordination organization. Right now, our ID services provide services to about 1,150 individuals with intellectual disabilities or autism, and they're registered with our office. The split between our counties is about 80% Cumberland, 20% Perry. Services include supports coordination, residential services, supported employment, job training services, adult developmental programs, family support services, which includes respite services, transportation, recreation, and socialization programs. Mark also wanted us to identify and just kind of talk a little bit about the strengths of the program. Some of the strengths, for years, they've been promoting competitive employment for individuals with intellectual disabilities and autism. Project Search started in our counties in 2017, and the goal is to teach employment skills and offer 3 different internships for on-the-job experience. 35 people have gone through the program thus far. 25 have gotten competitive jobs upon completion of the program. So that's a 71% success rate. That's pretty great. As of March 31st, 2025, 205 out of the 1,150 people have of working age. So 25% are working competitively. That's impressive. Cumberland and Perry counties continues to be a statewide leader and individuals working competitive. The statewide average is 18%. Today, 75% of our graduates are looking for an employment outcome. 10 years ago, only 25% were looking for an employment outcome. That again really speaks to a positive culture shift serving people with intellectual disabilities. Individuals with ID and autism are attending post-secondary education programs through the DREAM Partnership. Some of the local colleges participating in DREAM Partnership include Penn State Harrisburg, Slippery Rock University, Temple University, Duquesne University, Drexel University, and we have several individuals attending Penn State Harrisburg. Messiah University will also begin a new program with a residential component included in fall of 2025. Something else that's a strength of our program is we promote independent living and supported living. So the Pathways Academy program started in 2014, and it assists individuals wanting to live in their own apartment with learning the skills to be able to be successful doing that. It's a 12 to 18-month curriculum, and it's based on an opportunity to practice those skills every single day. And then upon graduation, they move into their own apartment with in-home supports available based on the individual's need. 22 people have graduated from the program, and a new class will start in September of 25. Independent living technology. So they offer an array of services and devices that assist people to ensure safety of people living in the community. So sensors, environmental controls, medication dispensers, those kinds of technological supports. And then the ID program really supports a lot of cross-system collaboration. Individuals can be involved in other human services systems such as mental health, children and youth, aging, and local school districts. So there is a mental health and intellectual developmental disabilities mobile behavioral support program, which is contracted through one of our providers. A complex case team for children and adolescents involved with children and youth, mental health, and IDD&A. Aging and ID team and the Aging and Community Services, IDD community advocates and providers of services for senior citizens. And then other services that are available to individuals and their families, supporting families initiatives. So that's the life course tools for planning purposes so they can help people across the whole lifespan. And then Community Links website, which provides informational and community participation type supports for infants through adulthood. And it contains lots of resources for families, community supports, formal government supports, and education about a variety of topics. And then there's the healthcare quality units, call that the HICU, providing training and support for all health-related issues, supports providers in providing ongoing care for individuals, and assist with discharge planning from hospitals. Now, if we talk about needs, staffing. Providers are still experiencing staffing issues. Residential programs are not able to accept referrals for their vacancies. Most day programs have reopened. There's still a few programs that have not reopened or have been combined with other existing programs. Development of new programs is very difficult right now because of staffing. Residential needs for individuals with challenging behaviors are often difficult to locate when individuals have to relocate to other counties to receive services. And then we continue to experience rapid growth in individuals being served, which is taxing to our supports coordination organizations. And then the lack of affordable housing for individuals who wish to live independently in the community. So those are the strengths and needs that, and Mark had asked that we talk about today. Thank you. Brenda, you want to talk about drug and alcohol services?
Thank you, commissioners, for providing this opportunity. As you know, much of our funding comes from the state and federal budget. What we're here today to talk about, though, is a small part of our funding, which is the Human Services Block Grant. Most of that funding goes towards providing treatment services for people, even though our mission is to do prevention, student assistance, treatment, and recovery services. What we're talking about today mostly is around providing services for people that need treatment that have crossed the line into addiction. One of our biggest concerns is the Medicaid cuts coming. We are to be the last, the funder of last resort, and we're seeing Medicaid cuts come. We have just went through the Medicaid unwinding, which has increased our costs for treatment, and there's more coming. We are losing the COBRA funds that ended actually for our department as of July 30th. So those funds won't be available. My predecessor and the financial manager have done just a wonderful job of weaving. So we'll pull a little from here, a little from here, a little from here. And, we've had a balanced budget for many, many years. We just recently did a needs assessment, thanks to the schools for doing the PACE data, which really helped us see what are the kids in our community need, and our priorities have actually changed. We'll be focusing on vaping, marijuana use, and alcohol. Opioids are, we're seeing a lot less concern around the opioids. The reason for that is because it's the multiple funds that it went to prevention overdoses. We too have very severe, very significant concerns about our providers in the community. We had 2 outpatient offices for substance abuse closed this past year, with nobody in sight that's willing to take county and Medicaid funding. And of the ones that are open, they're struggling to staffing. The same is true for our recovery organizations, which are great. The good news is we have several recovery organizations, and those people provide funding for people to walk through recovery with them. So I did want to share some good news, so that we do have at Cumberland County. We don't have any waiting lists for detoxes, so people need detox. We can find some place somewhere to get them into detox immediately. We do have several reinvestment projects that are coming through reinvestment funds from previous Medicaid dollars, and those are funding certified recovery specialists and 3 of our outpatients in Cumberland County. They're also funding contingency management training for staff within Cumberland County in treatment providers. But the good news is it's going so well that other counties are starting to pick up on it. So hopefully our clients are getting better care. Part of our mission is quality care, not just providing care to people. And then we also have a new recovery services group in Cumberland County that just started services in May. And all that funding is coming through the previous Medicaid dollars, and that's sustainable funding for Cumberland County. We have gotten our funding approved for the next 6 months from the state, but as you know, that's subject to will remain pretty consistent if we can get these dollars too. The great news is overdose have decreased 27% nationally. I mean, in our county, our highest was 86 in 2017, and we were down to 28 in 2024, which is still way too many. But you ask why? Well, a lot of it is because of the dollars that have been committed through the years to get people on MAP, to get Narcan out there, and we have several different ways that we're able to do that in Cumberland County. Fentanyl is still over half of the overdoses, but the stimulants and hallucinogens, I imagine I'll stand before you next year saying they're higher, over half. They're going up so fast. The bad news is we don't track alcohol. We are so used to overdoses with alcohol or people dying with alcohol in our society that we don't even talk about it. That's where we're seeing the greatest need for funding is people with alcohol addiction now. The opioid trust cannot help us with that, unfortunately. I do want to say several of our goals are to continue to be the funder of last resort. We also have changed our mission a little bit in that we want to be a service for the whole community, not just people that are eligible for our services. That doesn't mean we're going to pay for services. We can at least screen and provide coordination with providers and other resources for people. We also will continue to assist you in looking at the opioid trust funds and how those are spent within the county. But also there's some national trust funds or there's some national funds coming that are not part of the trust. And whatever you ask us to do with that, of course, we'll provide support. And then the goal is to strengthen local recovery resources. And that would be treatment providers. We can be a real encouragement to our treatment providers by getting resources that are available to them and then also to our recovery services people. So, any questions?
And I would just ask one, with the skills games and with the online gambling, are you starting to see any increase in gambling addiction?
Absolutely. When we did our needs assessment, we go before several different groups to ask, what do you think is a problem in the community? And just like other communities, we don't think we have a gambling problem. But we also know that we do have a gambling problem from the statistics. So we were able to secure a grant starting in October through the state with the gambling funds. So that's one area, if we can keep going after those funds, that's probably going to grow. But yes, the same brain that gets triggered by gambling gets triggered by skills game, different than a political issue, So part of our goals for this year is it's hard to get into schools to talk about gambling because nobody thinks they have a problem, and that's okay. But a way we are really hoping to get into the schools is to teach people how to be virtual citizens. And our local Carlisle school district just pulled the phones, from folks because they're realizing that brain is triggered and we've got to do something to help that brain. So we're really looking forward to hopefully getting more of our prevention teams in the schools around good virtual citizenship. And that could be with adults too, but we're not there yet, obviously. But that will be using gambling funds to do that.
Do we have any information, or do we gather information on any correlation or lack of between what's happening with gambling addiction and the presence of the casino now in our county?
Not specifically for this county. I mean, we can look into that. I don't have those stats, you
I
know.
mean, a lot of members of the public expressed concern at the time
Okay.
about, what's this going to do to in terms
Well,
of,
and the reality is anytime something's more available, it's more likely to cause problems for people. So whether we're talking alcohol, it's very available. We have more problems. Or we're talking marijuana, we're going to have more problems. Accessibility increases problems. So casinos can do that. But one of the biggest concerns is our phones. You know, that sports betting is just, you can, during a game, you can just keep changing your bet and pretty soon you're in so deep, you know, so. But absolutely, there is research obviously to casinos.
and is there, do the funds, I know they have to put money aside in addiction, notification, treatment, prevention, all of that. Does that interact with our services in any way?
Yes, yeah, in fact, we do have some gambling treatment funds. The hard part, and when I worked in other states with gambling treatment funds, it's hard to use them. Because people, when they really, really bottom out, a lot of times suicide is the option. I mean, and you're not going to intervene with people when they're winning because it feels good, you know. And a part of gambling addiction is chasing those losses. I'll do it until I can't do it.
Yeah.
I'm not sure what your question was. I kind of got off.
No, it's fine.
on a
In terms
tangent,
of, I mean, they're not an island unto themselves. They're integrated somewhat.
but there aren't gambling treatment providers. I was just with DDAP last week asking those questions, like, do we have a residential gambling treatment provider? Pennsylvania doesn't. We do have outpatients who are trained, and we can help with that funding, but a lot of times people have insurance too. So it's just providing that guidance. There's 1-800-BETS-OFF, which is a national line, but it's Pennsylvania it's ran through the state, which is a really good model instead of having counties run it, you know, because you've got the experts. Their chats and their texts are just going wild right now. So people are seeking some information.
And I imagine it would be hard to establish this, but we have seen the numbers, suicide numbers increase in this county for a variety of reasons, some known, some unknown. Do we have any information that establishes correlation in regards, you mentioned about gambling addiction, but is there any statistical?
I can get some nationally. I don't know if I can get it, you know, for the whole county. But yes, people with gambling addiction have a much greater suicide rate than even people with substance use. And the reason for that is when you're hitting bottom with gambling, you're going, I'm going to you and you and you and you and you, and I'm borrowing and I'm at work, I'm in trouble with work. They have no place to go. And so it's more, or at least people with substance abuse, they haven't burned all their.
Brenda, I think you mentioned that you were going to be going after more grant money, and that is set aside by the casinos, correct? That's part of that fund. Yeah, along with the line, yes.
Yeah,
Okay,
and
thank you.
DDAP has said in November, we can go back for more, so. And the other piece that's been really nice with DDAP is their gambling money used to be so tight. You couldn't spend it on if you were touching somebody with alcohol. Well, the prevention skills are pretty broad, really, you know, to prevent any addiction. So yes, that's one hopeful area is gambling.
Great, thank you very much.
So I think Kim is online to provide some information about homeless assistance and the Human Services Development Fund. Thank you, Kim.
Yes, hi. I found out about this last minute, so hopefully I have all the information that you need. So I have the Human Services Development Fund piece and the Homeless Assistance Program. The Human Services Development Fund provides funds to aging in the following areas: transportation, personal care, care management, protective services, and home delivered meals. We also contract with Contact Helpline, which is for information referral for 24-hour listening for health and human services information. And then also under Human Services Development Fund is children and youth. We collaborate with them per staff person for Cumberland Cares for Families. That provides in-home education and support for children from birth to 5 years of age. There's also service coordination and interagency coordination. Again, I think that Annie mentioned what Mark had said about the interaction between MH and us with lunch and learns and so forth. So that's included under HSDF also. Under homeless assistance program, there's 4 components, which is bridge housing, emergency shelter, case management, and rental assistance. Under the bridge housing program, that helps clients achieve independence and self-sufficient residence. We contract with Safe Harbor to provide transitional housing that allows individuals and families temporary housing within a supportive living environment while they prepare to live independently. And then new this year, we are hoping to contract with Blue Mountain Escape to have under the bridge housing, and they're dedicated to creating an environment that encourages sobriety and healthy living while assisting with housing, employment opportunities, mentoring, and fellowship. They have 6 locations between New Cumberland, Mechanicsburg, and Carlisle. Clients in the facilities for bridge housing can stay up to 12 months with an extension of 18 to 24 months with state approval. Under emergency shelter services, we contract through Community Cares for nightly shelter for those experiencing homelessness, domestic violence for emergency shelter for those experiencing domestic violence. If the shelters are full, we will assist with hotel motels under that program. Under the case management, we contract with Maranatha to ensure the financial stability of at-risk individuals and families by providing financial guidance, financial education, and bill payment services to those in need. And that again is under the case management component. And then internally, we provide the rental assistance program to prevent homeless or near homeless for clients where rent is in arrears, who have been given an eviction notice or a notice to quit from the landlord. This also includes assistance with security deposits and first month's rent. And then we also continue internally to provide case management to those clients to maintain stability. And then, do you want anything as far as budget with this or no?
Need that, Kim. At least not right now, but.
Okay, all right.
Unless anyone would like to know, but. Okay, go ahead.
I think that covers my piece then.
All right, thank you.
The
Thanks.
budget will be included in the final version.
So commissioners, is it appropriate now to open the floor for public testimony?
If that, I'm sorry, if you're finished calling all of your folks, yeah, yes, okay. Yeah, then I think it's a completely perfect time. And if appropriate, I think it might be easiest to begin with the folks online first. If there is someone online wishing to make a public comment, if you can use the raise your hand feature, that would be fantastic. And Lauren, do we have anyone showing that?
Yes. We have an Alyssa Smith. And we have to individually change their name. We also have an individual under here that changed their name. It was Harold. Yeah, it was Harold.
And Harold. So we have an Alyssa and Harold.
And Greg.
So Alyssa, if you're able to, if you wanted to offer testimony at this time, if you could do that, please. See if. Or do you see if she's trying to? No.
I think she must be located for the other agenda item.
Okay.
Commissioners, if I could, she's our grants
Okay.
at KDIC.
Okay, thank you. Thank you. I'm sorry, then you said there was a gentleman named Harold on the line as well? Is that related to this matter? Do we know? Oh, it is. Okay. Harold, if you're able and would like to make testimony, you could do so now, please.
Hello.
Hello, there you are.
Yeah, so we're here with the Meraki Star Center in Carlisle, and we have a testimony from one of our members here, a Karen Havner. If you want to come up closer to the laptop, just because I don't have a microphone.
Hello, I'd like to read my letter now.
Okay, that'd be great, Karen. Thank you.
Okay. Hello, my name is Karen Havner. I'm a consumer and a member of the Star Center in Cumberland County. I'm worried because Cumberland County has lost so much mental health funding and services. I have been coming to the Star Center since the year 2012, maybe even before that. County funding paid for the psych rehab groups that I was attending. I thoroughly enjoyed attending these psych rehab groups. I got a lot out of it. I saved all the paperwork and materials that I received from these groups. Cuts from the mental health services have prevented me from continuing to go to these groups since December of 2024. One of my favorite services that was cut because of decrease in funding was the Warm Line. The Warm Line was a non-crisis, over-the-phone, peer-to-peer support service. It gave people who received services the opportunity to work through their feelings. I also lost my job at the Warm Line. I really enjoyed my job and being employed at Meraki. I miss helping people and consumers since 2012. I worked there since 2012 till December of 2024. Thank you for taking the time to listen and for hearing my story. If you wish to contact me further, please do. I'd be delighted to hear from you. If my letter was sent in, I have my contact information is as follows. I have my name, my street address, my email address, my home phone, and my cell phone. Sarah may read this at the hearing. Karen Havner, July 30th, 2025. Today also happens to be my birthday. So thank you for allowing me to read my letter. God bless you all.
Thank you, Karen, and happy birthday. We
Thank you
are
so
in
much.
possession of the letter, and we will have your contact information. Thank you.
Thank you.
Is that everyone online? That is it.
Harold also wrote a statement. I don't know if he plans on reading his or not.
I get a little bit of a stage fright, so I might let someone else do that one for me, but
Okay.
sounds good.
I can do it. Yeah, we have it.
We have it.
Hey, Harold, they have you covered here in the room.
Sweet.
Thank you. So then I believe, is that it online? Do you know, Brian? Okay.
I believe so, yeah.
Okay, then we'll turn our attention to the room here, and if someone would like to, we'll start in the back. We have someone that, please state your name and then your comments, please.
My name is Deb Hellwig. I'm a resident of Cumberland County. And I have life experience with mental health issues. I work for a company called Consumer Satisfaction Services. I'm a senior survey specialist, and I'm not sure it's because of my age or my tenure with the company. But our executive director is unfortunately out of town, and she's asked me to read the testimony for her today. Her name is Jessica Paul, and she is the executive director of Consumer Satisfactions, Inc. Consumer Satisfaction Services, Inc. And we are involved with the CSP, the Community Services Program or Support Program here in Carlisle. Jessica says, as someone who walks alongside individuals living with serious mental illness, I've heard powerful stories about the value of county-funded mental health services. People consistently describe recovery-based supports such as peer support, psychiatric rehabilitation, supported employment, and community support programs as essential to their healing and progress. These services have helped individuals stay grounded, avoid inpatient settings, including state hospitals, remain meaningfully connected, and live successfully in their communities. Many have gained the confidence to share their personal lived experience in empowering and positive ways, something I have personally witnessed time and again. Recently, a number of individuals have shared a growing sense of fear and sadness due to the county's current funding deficit. People who don't have Medicaid and rely on county-based dollars are losing access to the services they depend on. These aren't just programs, they are lifelines. For those affected, losing access has left them feeling sad, overwhelmed, hopeless, and unsure of how they will cope. To date, 27 individuals have lost access to peer support of the community support program folks. 47 have lost access to psychiatric rehabilitation, and 70 have lost access to supported employment services. While peer support and psychiatric rehabilitation remain available to individuals with Medicaid, those without it no longer have access due to the lack of county-based funding. Supported employment, however, was entirely county funded and is no longer available to anyone, regardless of insurance status. Some individuals with Medicaid may be able to access alternative supports, such as employment-related services within psychiatric rehab groups, services through OVR, the Office of Vocational Rehabilitation, or Ticket to Work. But these do not offer the same level of intensive, individualized support that the county-funded supported employment program provided. These losses represent far more than statistics. They are real people in our communities who were making progress and now left feeling limited and uncertain. These services are working. They promote recovery, build resilience, give people the tools to thrive in their communities. But without flexible, sustainable funding, we risk cutting off the very resources that keep people well. We also risk increased crises, ER visits, homelessness, returns to inpatient care, including state hospitals, and ultimately higher long-term costs to the system. I urge the state to provide adequate, flexible funding so counties can continue to serve those who fall outside of Medicaid eligibility. We must invest in a mental health system that ensures access for all, regardless of insurance status, so that every person has the opportunity to live, heal, and thrive in their community. These individuals deserve consistent, compassionate care, not the fear that their recovery will be cut short by a budget line. Submitted with deep respect and commitment to the individuals and communities we serve. Jessica M. Paul.
Thank you very much.
Now, I have a couple other short ones that I would like to read. I worked at STAR, working with some of the consumers of the services at STAR Center. And I helped them with an outline, get the information into a letter so that they could participate today in this meeting. My name is James Baldick. I am a resident of Carlisle, PA. I have been coming to STAR for the past year. If I couldn't get these services, I probably would have committed suicide. I get counseling, one-on-one therapy, psych rehab, and groups. I get an understanding of what my mental health issues are about and how to manage those issues. I am an introvert, but if I'm engaged by people at STAR, I become social. My diagnosis of bipolar can cause stigma. If I could not come to STAR, I would be in the hospital or dead. I just got a peer support person, Kate, and a case manager, Maggie. Maggie helped me find a place to live Without her, I would be in the hospital or dead. I'm asking you to continue these services because they saved my life. Thank you for hearing my story and for your consideration of my request. James. I am Ton Quang Nguyen. I'm a citizen of the United States and I have lived here for 25 years. I have been coming to the Star Center for 7 years, from November 2018 to July of this year. My services at Star are psych rehab, groups, supportive living, and medication management. I can get help with shopping for groceries and going to doctor appointments from my case manager. My peer support person is now on medical leave. They help me with communication skills and how to talk with people. I miss them. If I don't receive these services, I won't be in good shape mentally, physically, or socially. I know many people who would also be in bad shape. Please don't cut the funding anymore because we all would suffer. Thank you for listening to me. And thank you.
Thank you. Next, do we have someone?
I'm Sarah Spohr. I'm the Community Support Program Coordinator for Cumberland and Perry County. I have a few to read here. I'll read Harold's first. My name is Harold Weber. I'm a psych rehab worker at Marquis Star Center in Carlisle. During the time here in this space and community for 2 years, I've met many people, wonderful people who mean well and want to be active and helpful community members. The recent loss of services like county-funded psych rehab and supported employment has caused a lot of distress among our community. And I have personally seen how deeply our community is hurting. Our community members who lost these services are left suddenly without key help or guidance. Many folks, myself included, are often fear-stricken and need help with assertiveness. Without at least some help from others, many haven't even began to let their voices be heard, left alone or abandoned by their very friends, family, and neighbors. I ask that when decisions are made in an attempt to represent our communities, that these quiet and kind souls are remembered and that they are represented fairly and justly as any other American citizen. It is their right. Thank you for your time and consideration, Harold Weber. Another participant, Richard Green, writes, after the CSP meeting, I realized how much time and energy that put into the STAR program, steps towards advocacy and recovery. I don't know where I would be if it wasn't for this program. I've learned computer skills, community skills, and how to interact with this mental illness that I have. We at STAR have group meetings throughout the days that help us to learn each other's ways. And we join together and I have become like a family. Together, we've learned how to react in public, and the outings we go on help us to realize the difference between healthy living and stigma about mental illness. I hope for the future to be a more normal person and continue to grow spiritually, mentally, and physically. Thank you for your time. Sincerely, Richard Green. Another participant, Brenda Jumper. My name is Brenda Jumper. I have had seizures since I was 8 months old, and I am now 63. My doctor has changed since I wrote my last letter on Advocacy Day at the Capitol. I will get a new doctor on August 20th, 2025 to take care of my teeth. Star Center offers friendship, lunch daily, and crafts. I only have social help and not counseling. I am no longer eligible for group because of the loss of funding. I hope that funding can be returned to Star so that I can have the counseling that I need. Thank you for your time. Dawn Kohler. My name is Dawn Kohler. I live at New Visions Housing on Hanover Street in Carlisle. I have attended Star Center for psych rehab and groups for about 10 years. I am able to talk to my peers about my issues. I also help out in the kitchen. I get worried about the funding being cut. My case manager, Christine, through New Visions, helps me do my bills, grocery shopping, go to the laundromat, and doctor appointments. My peer support, Alex, talks to me about how I'm doing through the week. I can't work because I have seizures. I really couldn't make it on my own. I would be a terrible struggle, and I would probably be homeless. How could I make it on my own if services are cut anymore in the future? Thank you for listening, and please don't cut the services anymore. Those of us with mental health problems would suffer a lot. Thank you, Don Kohler. One final one by Matt M. My name is Matt M. I have been a consumer at Star for 10 or more years. I was in a hospital for mental illness. When I got out, I got housing services in an apartment at Lowther Street apartment building in Carlisle. My Star services are talking, psych rehab, groups, lunch, and recreation. Without these services, I might be back in the hospital. I get to see people who also have mental illness and talk. We get some learning services at Star too. Without them, people would just be roaming around. I get my medications at Marikey. Without services, I might not have meds or a home. If we all lost our funding, people might do something stupid, things like crime or things we don't want to do. We should get funding. I don't know what I would do. I might be homeless or in a mental hospital. It was hard to write this letter. Thank you for listening, Matt. And thank you.
Thank you. If it's okay with the commissioners, I'd like to sit here to speak with you.
Sure.
Thank
Can
you,
you
Brian.
pull up a chair with Brian or?
I can pull up the chair with Brian. Brian out.
You can
Or
Thank
if
you,
you,
Brian.
if you could, please just state your name. I think we've
Yes.
met before, but. Yes,
Hi, Gary. Good afternoon. I am Jennifer Polhumus. I am a person who lives with the experience of mental illness. I am a family member. I have been a recipient of many county-funded programs and services. I am a provider. I'm a student currently finishing my master's degree, preparing to go on for my doctorate. And I'm also a business owner and an author. My 5th book was just released this month. I didn't come here today to beg for money or reinstatement of county-funded programs and services, or to lash out in desperation or anger. I came here today to do 2 things. Number 1, to say thank you. And thank you. I am the return on your investment. And number 2, I came here today to share radical acceptance and to offer some hope. Radical acceptance of the fact that the county has lopped off funding for programs and services to those it serves like limbs of a body. And people are hemorrhaging out with no one to sop up the carnage. And we can cry and wail, or we can radically accept and begin healing. We are no strangers to wounds, and we know the ways of resiliency. Radical acceptance is not resignation. Radical acceptance is a courageous act of hope. In the words of the singer Kalichi, hope. Hold on. Pain ends. It's a remake of Tracy Chapman's song, Fast Car. So maybe we can make a deal. Maybe together we can get somewhere. Any place is better. Starting from 0, got nothing to lose. Maybe we'll make something. Me, myself, I got nothing to prove. Yes, we embrace hope, and we will find healing.
And when more is ripped away from us, leaving our bones broken and jagged and raw, we will turn to our communities. And we will turn to each other and connect. I'm Jennifer Paul-Hemus. I am your return on investment. Come with me, please, and hope, HOPE, heal openly. Possibilities are endless. Do you have any questions for me?
Thank you.
Thank you for the time to
Thank you.
speak.
I believe we have, sir, if you would like to make any comments?
Good afternoon. I'm Bill August. I serve as the superintendent of Shippensburg School District. I'm here with what I think is probably a pretty niche concern, considering all the vast issues that stand before the commissioners and all the great work that people are doing, in so many different ways. I want to begin by acknowledging that in my role, I'm very familiar with having to make difficult decisions with extremely limited resources and funding sources that you don't have control over. So I feel that we may be kindred spirits in this. Having said that, I'm here to speak about the recent cuts to secondary school mental health supports, specifically the removal of days onto service on our student assistance teams in all of our counties, schools, middle schools and high schools. Let me be clear. I'm not here to berate or chastise, commissioners. Rather, I want to speak to the importance of the support that was cut and what it means for districts, students, and families that we all serve in Cumberland County, and to encourage the commissioners to restore these funds as soon as possible, given a multitude of needs. For those who may not be familiar, the Student Assistance Program is a state mandated process that has to take place in schools. So we, as school districts, have to have student assistance team. I'm not arguing about that. It's a great thing, but we're required to have it. It exists to identify and support students who may be struggling with substance use and/or mental health challenges. Students are referred to a multidisciplinary team of teachers, counselors, administrators, and social workers who collaborate to determine how best to support them and their families. Previously, the county provided mental health professionals to serve on these teams. With parental consent, they conducted expert screenings to assess risk factors and offer voluntary recommendations for care. And I'm told, having been on teams in my career, that third party outside of the district relationship is extremely valuable in moving some of our families into services or getting the help that they need, because there's blurring of lines sometimes between the schools and families. And so, the third party is critical. This is time-consuming, highly specialized work where with parental consent, these experts perform screenings, and those screenings, give options to families and kids that they are free to take advantage of or not. With these cuts, that responsibility now falls back on an already overwhelmed school based mental health professionals, unless districts allocate their own limited resources to fill that gap. I have no doubt that the decisions to make these cuts was a difficult one. However, I want to add some perspective, which I'm sure everyone in this room already kind of knows. 2021, the U.S. Surgeon General declared a national mental health crisis, citing rising rates of depression, anxiety, and suicide among children and teens. The 2023 Pennsylvania Youth Survey, or PACE survey, which is our most recent one, confirms that this crisis is hitting close to home. According to that survey, the students in grades 6, 8, 10, and 12 were asked whether they had seriously considered suicide. 16.1% said yes. Even more troubling, 12.5% reported that they had actually made a plan. In my district, those numbers are higher. I could certainly share more distressing statistics, but the point is this: cutting mental health services now in the midst of a youth mental health crisis is like sending firefighters home while the entire department is battling a 4-alarm fire. This crisis is an all calls for an all hands on deck approach. And with these cuts, county schools have to shoulder more of the burden, a burden that they are not resourced to meet, and often can't fulfill their own missions without addressing. So we are not a mental health facility, but often parents come to us expecting us to be that. In closing, I want to thank you for the work you do. I know your jobs are difficult and the decisions you face are even harder. With that said, I would urge you to consider how we might restore or reimagine support for student mental health in our schools and the county's responsibility towards those efforts. These needs don't disappear when funding is cut. They simply shift onto the shoulders of others, and that's neither right, fair, or effective. Thank you.
Anyone else in the room wishing to offer testimony at this time? Any, is that it then?
I believe so.
Okay.
I'd just like to add a couple of things. So we're sitting here, we're having a conversation about our next block grant, which is incredibly important. It's very clear that it's incredibly important for everyone that has spoken here today. It's beyond important. And so county commissioners across the Commonwealth received a letter dated July 29th from the governor's office of the budget. And this is what this letter says. In the short term, it's important to know how this situation being the fact that we do not have a budget at this point in time from the Commonwealth, will impact your organization and its fiscal responsibilities. To that end, information regarding some of the payments from the Departments of Aging, Drug and Alcohol Programs, Health and Human Services that will be delayed over the next 6 weeks in the absence of a completed budget are as follows. I'm not going to read them all, but I'm going to give you a couple of them. And remember, this is statewide. $12.88 million in payments to the area agencies on aging for July and August. Drug and alcohol programs, $9.95 million in quarterly payments to single county authorities. $187,000 in quarterly payments for training of substance use disorder and problem gambling service professionals. $21 million in quarterly payments for state opioid response funding. More than $1 million in quarterly payments for maternal and child health services and $1.8 million in quarterly money for newborn screening. $15 million in quarterly advances for behavioral services beginning in July. $390 million in county child welfare payments for July and August. $8.5 million in payments for domestic violence for July and August. $3.5 million in quarterly advances from the Human Services Development Fund. An estimated $33 million in child support enforcement payments for July and August. Approximately $10 million for community-based family centers for July and August. $5.6 million in quarterly advance payments for homeless assistance. And this is because the state has not delivered the budget. It is not lost on me that we are having this conversation about our needs-based grant request for 2025 and 2026. And we're headed into a sling. And it's because we need a budget and it's not done on time. And boy, do we need our legislature to get that done. We need them to get that done. So I appreciate everyone's testimony here today. And I know how important these services are. And I would like nothing more than to get the money that we need, have some funding restored, and bring these services back. I would like nothing more than to have that done. You talked about hope, and I appreciate that, because I will tell you that I feel very hopeless.
I don't.
I'm glad, I know, I'm gonna call you.
I'd be happy to tell you why.
Because these are so important, so important. And so I just wanna let you know, I guess, how I feel about it, but this is 6 weeks, right? 6 weeks that is being held back because then we don't have a budget. So we need one. We need budgets. We can do our good work.
Yeah, and Commissioner, I will just say, while I certainly appreciated that letter, I don't, on some level, it seemed like a little bit of political finger pointing, and I really respected the information that was disclosed. And can only say, just for the residents of Cumberland County, we've taken steps to be prepared for this. We are fortunate that we are able to withstand this, certainly not indefinitely.
Right.
We are not, I don't want to be alarmist in that folks would believe that we are discontinuing services immediately because those funds are not being restored or not being provided. We are able to sustain services for a period of time. We're looking at those numbers repeatedly to see exactly what that looks like, how long before ramifications are to our program. So I am hopeful that they will work it out. But the resounding cry that I've heard is that people are now just hoping for the funding that they had received previously. Because like you, I do believe a lot of folks are hopeless in that there will be any increased funding, but that there would be at least funding at the same level as the prior year.
So, well, and this county is prepared, but we did talk a lot about things that have been cut. And it is absolutely because the funding is not coming from the Commonwealth of Pennsylvania. And Annie, you've taken me through this so many times, right? We can take it back to the closing of the state hospitals and the promise that people were going to have, that we were going to have funding. And then we never got it. And then demand has increased tremendously. And the funding is not there. And it is so important. It's important as a measure right now, right? It helps people now, but boy, does it help people in the future. So I mean, they have to pass a budget. They're not going to be able to get away with not passing a budget. I am on the Human Services Committee at the County Commissioners Association of Pennsylvania. CCAP has gone to the legislature, lobbied the heck out of them for many years for a tremendous increase in mental health funding. It's not here. It's not here. So we have to continue this hopeful work, right, of asking for things, making the need known.
Can I just say, I know that we are in a crisis situation and that I sit with people in my office and they are terrified and they are hopeless. But something that I learned from Dr. France, who led up the county warm line in his book about crisis and helping people in crisis, was that the Chinese characters for our word crisis is a compound word. It means danger and opportunity. We are sitting on the horizon of endless possibilities. We're the ones that can make something grow out of a cesspool. Because you need the mud to grow the flower. We can do this individually at a time. We can go home and instead of collapsing, go home and pet the cat and make a meal with whatever we have. And we can reach out and connect with somebody, not on our phone, but reach out and touch their flesh. Go out for coffee with them. That's where we find hope, with the connection in each individual person that is sitting in this room and the people that we go home to and touch. Because we can't look to the county or the state or the federal government to save us. We can't. It reminds me of when I was strapped to a gurney in an emergency room and my mother came up to me, who always came to rescue me. And she looked down at me, she said, "I can't do anything for you anymore." And she walked away. And it feels like our county and our state and our government is walking away. But we are resilient and we will thrive.
Thank you.
I love your optimism. And Commissioner, there is an article, I believe it was published this morning, a Spotlight PA article that really summarized quite nicely, Annie, I thought, how we've gotten to this point. So if folks are interested, to your point of the backstory of when they closed the facility. So, all right. If there's no further comment surrounding the public hearing, I believe we will move right into the finance meeting. Oops, do we have to take action on this?
We do.
Oh, there's not an action item on here. So, Annie, please provide us guidance on that.
Are we moving to approve?
Well, yes, we would need approval for the Human Services Block Grant Plan, and then we will be submitting it to the state on behalf of the commission.
So I'm going to approve the Human Services Block Grant.
So it's moved and seconded. The only discussion I would have is a logistical matter. Angela, do we need to modify an agenda in order to accomplish that?
I don't believe so. I conferred with Keith on how the public hearing was listed on the agenda, and he indicated nothing else needed to be listed underneath that. I will confirm with him after this if that is appropriate.
There is an affidavit that needs to be signed that goes with the plan. Your signatures.
Yeah, I had seen that. Okay, it's moved and seconded. All in favor, say aye.
Aye.
Aye, thank you. So now we will open up the finance meeting and begin with what we called it to order. We'll begin with a roll call then, please, Lauren.
Absolutely. Commissioner Nieder,
I'm here.
Commissioner Fauci,
I'm here.
Commissioner Eichelberger.
And there is a time allotted for public comment at this moment on the finance meeting. And I think everyone has spoken on other matters. And we will then move into the approval of the minutes of the July 9th finance meeting.
I will move to approve.
It's moved and seconded. All in favor, say aye.
Aye.
Aye. And that leads us to the one agenda item of cooperation, a motion to approve a cooperation agreement among Cumberland County, CADIC, and Penn Harris Hospitality RELP with as it relates to grant funds and the redevelopment project. I believe we have Greg Welker on the line. Greg, are you there?
I'm here.
Greg is with CADIC and is bringing this forward. Thank you, Greg.
Yes, thank you for including this on the agenda today. So what you have in front of you is an updated version of the cooperation agreement that was passed last fall. It was brought to our attention when we brought it to you last fall that it was a $2 million funding commitment. In hindsight, the Office of the Budget combined a prior award from 2021 to the same project, which brought the total to $3 million, and that's the reason we're bringing it back to you today.
So this is merely an update to combine the two. It's the same document that had been approved in the fall, just an increased amount on that document.
Correct.
To accommodate the state's combining of those two RACP grants.
Exactly. Yep.
Perfect. Thank you. Did anyone have questions of Greg?
I do not. I read it. I know that our solicitor looked at it.
Yes. Would anyone like to make a motion?
I will move to approve.
I'll second.
It's moved and seconded. All in favor, say aye.
Aye.
Aye. Thank you very much, Greg.
Thank you.
Is there any other business to come before the board at this time? I'll entertain a motion for an adjournment.